was quite early after I had discussions with the doctor that delivered my first son. And he had told me that my pelvis was quite small and my son was almost 10 pounds, so he said there was no way he was coming out. So yeah, I just decided to go elective this time. Hi. Just have an appointment today. I'm anticipating this one to be a lot better and a lot smoother, and nice to be awake and actually see my child being born.
When we bring the ladies in, we usually like to check on their well-being, how they've been going over the last couple of weeks since we've last seen them. Come on, Jennifer, we're just going to do your visit today. If you don't mind having a seat in the corner, I'll just have a seat. So how have we been going?
Good.
Good? Yeah? Yeah? Baby moving?
Yeah.
Okay, and so we also like to check that the baby's been moving. That's really up at the top list, because we know if the baby's been moving well, that the baby's nice and well and healthy. And when we also listen to the fetal heart with a Doppler to make sure the heart rate's within normal limits. We also then do a measurement of the lady's tummy, and it should match up to about how many weeks pregnant they are. So then we're checking that the baby is growing while it's sitting down there. We then like to check that the mother's blood pressure is within normal limits, so we're concerned about her health as well. Blood pressure's good. Okay, which is good. It's sitting on 120/60. Then we just ask about what they're going to do over the next couple of weeks, do some education around some breastfeeding and expressing, or even sometimes contraception or any other tests that we may do through the pregnancy. We check that they've all been updated, like blood tests. Okay, Jennifer, it was a pleasure. We'll see you next week, okay? We'll pop you in with the doctor. I'll find the doctor where she's hiding. They discuss their mode of delivery with the obstetrician, and if they've had a previous caesarean, they usually see the anaesthetist if they're going to have another one. And it depends on what happened the first time around as to how that goes, whether they have a normal vaginal birth after caesarean or whether they choose to have another caesarean section. And that's where they come on with the other doctors.
The midwife has already done your routine visit for the morning, hasn't she? But I think we're here to talk about the plan for delivery.
Yes.
It's very important we get a complete workup pre-op.
Yep.
We want to make sure we've got the health of you and your baby at the best condition possible. This is the caesarean paperwork we have to do together. Also, there's some brochures there on having your baby by elective caesar. One of the things we do when we send you to the anaesthetist is give you this brochure on anaesthetic for C-section. So I'll put those with those other brochures you've got there. And the other thing we need to do today to get it all booked in is go through the consent form together. And being an elective C-section, it is a slightly different environment compared to the chaos and rush and anxiety that can happen with an emergency C-section. You'll have a full team on board. There'll be the theatre nursing staff team, the theatre anaesthetic team, and the obstetric team, which is the obstetrician and their assistant, as well as the midwife. So today, after consulting with Jennifer, we've decided to definitely go ahead with her caesarean section next week. And I feel her questions have been answered, and that seems the appropriate decision.
Consultation with the obstetrician went really well. I feel that because we both communicated all the history of everything that went along, that it made her more aware of where I was and where I'm going to, and it's going to be a lot better an experience, and I think that's what she wants me to have, a nicer experience than the last time. So, yeah.
In this pre-admission clinic, what we do is we try to get their story, assess, listen to them. So I've got this referral from Sarah. And how many weeks are you now?
37.
This Wolf Parkinson White, how much does it trouble you? Is that only you?
So my grandfather and both of my sisters have it.
So what sort of symptoms do you have? Do you have any problems in your heart going on?
So I just had the racing heart. Sometimes it would be 180 beats a minute.
Right. For your previous Caesar, what sort of an anaesthetic did you have?
General anaesthetic. My first caesarean was very hectic. I went in and they put the Prostin gel on me, and then I straight away had an allergic reaction to it. And then they gave me another medication to counteract that, and it made me faint. So within 10 minutes I was in theatre and under general anaesthetic. 3 hours later I woke up and had a baby.
We see a lot of patients just like Jennifer, who had previous Caesars, sometimes under general anaesthetic, under emergency, or even a spinal anaesthetic as an emergency Caesar, we have seen that patients don't remember much what happened to them at that time. It was a kind of a sort of a blurred dream that had just passed away, can't remember exactly what happened. So this time it is a bit different. So you're going to be awake, and we will do it under a regional anaesthetic, what we call a spinal anaesthetic. Okay. This is the one that we like you to concentrate on actually. This pamphlet is something that we have written here in this hospital. When you come into the theatre first, we'll do a little cannula in your hand, and then we'll get all the fluid set up. After a group check-in, we go into the theatre room. Your partner will, or husband will have to, take a seat in the anaesthetic bay when we go in.
My name's Shani, I'm the anaesthetic nurse.
So we will get you to sit on the operating table sideways. My anaesthetic nurse will put all the monitors on, get one blood pressure, get things ready. And the anaesthetist on the day will be scrubbed, masked down to make sure that everything is nice and sterile. So first thing that happens is they will clean your back with a very cold solution. After we do that, we start preparing our trolley. Why we do that is because we need to let that solution dry into your skin to make sure that it is properly sterile. And then what we do is we'll put a sterile drape on your back. Then at that time we will get you to get into that real position with your chin on your chest, holding onto the pillow, and just slump your shoulders and stay still for some time until we get things done. The anaesthetist will feel your hips at the top of your hip levels just to make sure that there's a level. We'll come to the midline and feel for your spinal spaces in the midline.
3, 2, 1.
Then we put some local anesthetic to numb your skin in there. Local anesthetic, when it goes in, of course, the needle you feel, and then the expansion, the pressure you will feel in there, and then literally in about 3 seconds it gets numb in there, and through that numbed area we put that little spinal needle that I talked to you about. When I say little, it's thin but long needle. We put it in until it gets into the spinal fluid, and then we will give the medication. As soon as the medication is given, you'll start feeling your bottom going warm and pins and needles running down your both legs, and then the lead starts going heavy. So immediately we will get you to lie down on one of your shoulders and get you to turn on your back. We will be measuring your blood pressure every 1 minute until your baby comes out most of the time, because first 10 to 15 minutes the blood pressure can drop. We will check your anesthetic level with some ice in a glove. We use the ice as a sort of a clinical marker to get a sensory level. The reason to use ice in a glove is because you lose your hot and cold sensation. When you and the anaesthetist both agree in the midline and on the sides that your level is around the mid-chest, and also your legs are heavy, we let the obstetrician start working on it. The whole idea is to give the patient good understanding what to expect on the day. I feel they're well informed. When they come on the day, and when the anaesthetist on the day start talking to them of getting into position, they know exactly what they need to do.
I feel like everybody's aware and everybody is on the same page, so everything should be smooth.
It is a team effort. We work as a team. We work together, like the obstetrician, the midwife, the anaesthetist. We all work together in a team.
What we're trying to make sure that the patient's journey, satisfaction is a lot better, and she understands. And I'm sure she will enjoy the baby, the moment that the baby is born, a lot better.
We've got multiple people that play an important role in making sure that everything goes smoothly and safely for mum and baby, and that this is an experience that is super special for them, but it's also a privilege and a joy for the staff involved to be able to witness and support that family through that really momentous occasions.
And that's what we want our patients to feel. We want them to feel supported at all times, no matter what procedure they're having done. And to do this, we introduce new information and better information.
I'm anticipating this one to be a lot better and a lot smoother, and nice to be awake and actually see my child being born. So yeah. expecting everything to go pretty straightforward and just be nice and relaxed because the last one was so rushed. I'm actually looking forward to having a normal procedure. I don't feel any anxiety at all about it.
Mum comes out, we keep her here for about half an hour just to monitor her and make sure she's okay after she's had major abdominal surgery.
My name's Alexa.
If Mum pre-empts that she'd like a caseload midwife, she's entitled to have the baby down here where she can provide skin on skin and breastfeed.
It felt really good because he latched straight away and he was breastfeeding perfectly straight away, and I didn't get that with my other son.
The normal role in the postnatal period that we do as a midwife is normal observation checks, so checking blood pressures, temps, pulse, making sure that everything's normal. Hello, I just need to do a blood pressure on you. Are you okay with that? Yeah. Beautiful. We'd also do like a head to toe check. So obviously there's physical sides to having babies, so we ask how they're feeling, what their pain's like. After a caesarean section, one of the main checks we do is obviously checking the wound where baby came out, making sure that that's all good. And also obviously they usually have medication that makes them not move so that they don't feel anything. So we also make sure that they're getting up and mobilising and that their legs are okay.
Do you have the notes for Jennifer? Thank you. The first thing we check is to make sure that she's comfortable. Hi, good morning. How are you feeling this morning? Good. We want to make sure that she's getting enough painkiller, that she's used the painkillers that are on offer and that she's using them in the right way. Sometimes people are afraid to use painkillers. You uncross your legs for me and just push up against my hand. That's good. Wow. Then we check to make sure that you've recovered the sensation in your legs and the movement in your legs. Push up, push your toes up against my hand. That's it. And we also check to make sure that your back, where the needle went into your back, is nice and clean and dry and there's no signs of infection or any problems there. Any pain down there? No. We make sure that they're comfortable before they go, so that they're not, struggling with pain at home when they've got a new baby.
I felt really relaxed just because I knew what was coming ahead and I knew all the team that were going to be in there and I met everyone, and yeah, it was just very relaxed, just knowing what was to come. I felt them push, and it just, when they pushed, I felt him move from the top down, and then I felt him when he came out. I just felt everything just settled in my belly, it just felt very different.
I chose to have elective C-section because of the previous cesarean section. I was just worried about the anesthesia. It's really helpful because he demonstrated how to make my body posture during the procedure. During the procedure, when the nurses asked me to maintain that posture, I still remember his voice. It's really helpful about this. It got all the information. It helped us to prepare mentally. It helps to reduce our fear and anxiety.
The introduction of an anaesthetist clinic is where the woman gets much more information, much more counselling about anaesthetics and theatre and what's going to happen to them when they reach theatre.
When I was in Poland, I arrived at the emergency. It turned out that I needed to undergo an emergency C-section, and the experience was actually quite horrific. I wasn't told what's going to happen to me. I wasn't asked if I'm okay. They just put me on a table. If I had to compare it with Nepean hospital, the nurses and the surgical team was there to calm me down and talk to me and actually explain the process to me, the whole process. I'll probably not even allow them to touch me. I was shaking and trembling. I actually cried. I cried not because I just gave birth to my baby, but I cried because this procedure was not a traumatic experience.
Everything went really smoothly, and it was really good getting to know all the staff before, because I'd already met all the staff at Katoomba and I knew who was going to be delivering my baby. But yeah, everything went to plan. That's the only thing I was worried about at Nepean was not knowing everybody, and then everything just happened really quickly and it all went really well. So yeah, I was very relaxed. Yeah.